This page of notes is for the vasculature system of the head and neck, specifically the arteries that supply the blood, the veins that drain everything, and then the lymphatic system. This is important to us as medical physicists when we're doing imaging, especially if we're using like contrast, or if we're doing nuclear imaging where we're introducing an intravenous tracer. So I drew this little photo of the heart. The aorta is coming out of the left ventricle, and then we see the aortic arch, and it's splitting off into many different little branches or arteries that are going to supply the head and neck. And I'm going to talk about them a little bit. I'm just getting it all drawn out here. These split off at the level of the thyroid, just to give you some landmarks. So they split into two there. This is the right side and the left side of the heart. And the blood flows up through it this way. I'm going to label all of the different specific parts that I'll talk about. A lot of these are symmetric, so the right and left are both the same. That's why I'm doing like 2R, 2L. So let's get into some detail now. Coming off of the aortic arch, we have three main branches. The first one is the brachiocephalic, that's on the right side. And after, we also have the right and left subclavian. On the right side, this comes out of the brachiocephalic, and on the left side, it comes out of the aortic arch. We have the right and left common carotids. These are very important. On the right side, again, it comes out of the brachiocephalic, and on the left, right out of the arch. After that, we have the right and left vertebral arteries. These come out of the right and left subclavian arteries. We have the right and left internal carotid and external carotid. So those are the ones that split up there at the thyroid level. I'm putting stars next to these because these are the ones that are going to supply the brain, and I'm going to talk about those in more detail later. The external carotid supplies the face, like the more superficial things. So we have a bunch of branches that come off of it. The superior thyroid artery supplies the thyroid. We have the lingual, the maxillary, these kind of go along with their name. The facial, which is like the muscles of the face, the occipital, the muscles in the back of the skull, and then the superior temporal arteries. And these all come out of that external carotid. So let's talk about the blood supply to the brain. This is like a little outline of the brain. We have the medulla, the pons, the cerebellum, and the cerebrum. Coming up the medulla, we have these two arteries. It's number 4 on the list over there. These are the vertebral arteries. These actually travel up through the transverse foramen in the cervical vertebrae. These have little branches that come off of them that supply the cerebellum and the spinal cord. They merge here at the junction, like where the pons and the medulla come together, and they form this one bigger artery called the basilar artery. And then this splits up into different arteries, and these all supply the cerebrum with blood. There's a bunch of cerebral arteries. And then this comes up further, and this is the posterior communicating arteries. And this is like the starting of the circle of Willis that you hear about. And here we have our second supply of blood coming in. This is number 5 on the list to my left. These are the internal carotid arteries from the right and left coming up from below. The kind of little wings coming off of them, those are also cerebral arteries. They're going to provide the cerebrum with more blood. And then the little guys are ophthalmic arteries. These go to our eyes, like our retinal, supply our retinas with blood. And then these continue towards the front of the body or towards the front of the brain and provide or further cerebral arteries. And then it connects in the center there. That is the anterior communicating artery. The blood supply coming from the vertebral arteries supply about 20% of the total brain's blood supply. And then the internal carotid arteries supply about 80%, so that's the workhorse there. I heard someone once compare the circle of Willis to like a little alien, and I thought it was a good way to remember it. In the black is things that don't actually exist, but the red is, you could compare that to different arteries. She's got a little antenna and, 4 arms. I thought that was a cute way to remember it. So let's move on to the venous system or the drainage system. And kind of interesting about the head and neck is that this does not follow the arterial system. I mean, that's important to remember because that's unusual in the human body. So there's veins that come from our brain and our skull and our face. There's a bunch of them. I'm not going to get into too detailed, but these will drain into the dural sinuses in our brain. These are like blood collecting pools. There's 11 of them in total. And then these will all kind of come together and drain into the internal jugular. There's another set of veins like in the back of our head and around the side near our ears, and these will drain into the external jugular. Also, the vertebral veins will come into the external jugular. The external and internal jugular will come together on each side, so there's actually going to be a left and right brachiocephalic vein from this merger. And the left and right side will merge together into the superior vena cava, and that superior vena cava will drain into the right atrium of the heart to start that systemic circulation all over again. So superior vena cava is right there, going into the atrium, and then the brachiocephalic right and left. Now we're going to talk about the lymphatic system, and the lymphatic system is meant to filter out, tissue fluids and plasma of debris and pathogens. The head and neck has a lot of vessels and nodes from the lymphatic system, and they're things that might show up on imaging. So it's important to know that they're just there. I don't think we are expected to know what they all are. There are some special nodes that I'm sure we all know of, the tonsils. These are lymph nodes that are located in the throat region, and they are meant to filter out pathogens that might enter through our mouth and our nose. Now I'm going to pull up some CT images where someone has actually highlighted or colored out all the lymph nodes. I found these on Radiopedia, a coronal view and an axial view. And then we're going to look at some people who are sick. These are also from Radiopedia. And you can see, obviously, that it doesn't look quite normal. So you should be on a lookout for something that you don't really know what it is, but it doesn't look normal. This top one, the parotid nodes are enlarged, and that's because this person is fighting a tuberculosis infection. On the bottom, there's massive enlargement of this person's cervical lymph nodes, and this person actually has lymphocytic malignancy, so a form of cancer in their lymph nodes. So that's it for this study guide. Thank you for watching. The notes will be up on the webpage.